Hello and welcome to our channel. Today, we will be answering the most popular questions about sickle cell anemia. If you are new here, please make sure to subscribe to our channel for more informative videos like this. Now, let's get started. Our first question is, what is sickle cell anemia? Sickle cell anemia is an inherited blood disorder that affects the red blood cells. Normally, red blood cells are round and flexible, but in people with sickle cell anemia, the red blood cells are crescent or sickle-shaped, which can cause them to get stuck in small blood vessels, leading to pain and other complications. Sickle cell anemia is caused by a mutation in the gene that produces hemoglobin, a protein in red blood cells that carries oxygen throughout the body. This disorder primarily affects people of African descent, but it can also occur in people of Hispanic, Middle Eastern, and Mediterranean descent. In the next part of this video, we will explore the causes of sickle cell anemia. Moving to the second question. What causes sickle cell anemia? Sickle cell anemia is caused by a mutation in the HBB gene, which provides instructions to make a protein called beta-globin. This protein is an important component of hemoglobin, which carries oxygen throughout the body. The mutation causes the beta-globin protein to form abnormal chains that can cause the red blood cells to become sickle-shaped. People inherit 2 copies of the HBB gene, one from each parent. If a person inherits 2 copies of the mutated gene, they will have sickle cell anemia. If they inherit 1 mutated gene and 1 normal gene, they will have sickle cell trait. In the next part of this video, we will discuss the symptoms of sickle cell anemia. Our third question is, what are the symptoms of sickle cell anemia? The symptoms of sickle cell anemia can vary from person to person and can range from mild to severe. Some common symptoms include pain in the bones, chest, abdomen, and joints, fatigue, paleness, shortness of breath, and frequent infections. People with sickle cell anemia may also experience delayed growth and development, jaundice, and vision problems. In severe cases, sickle cell anemia can cause stroke, acute chest syndrome, and organ damage. In the next part of this video, we will explore how sickle cell anemia is diagnosed. Sickle cell anemia is typically diagnosed through a blood test that checks for the presence of abnormal hemoglobin. This test can also determine whether a person has sickle cell trait or another type of sickle cell disorder. Other diagnostic tests may include a physical exam, medical history, and imaging tests, such as an ultrasound or MRI. If you or someone you know is experiencing symptoms of sickle cell anemia, it's important to see a doctor for an accurate diagnosis. Can sickle cell anemia be cured? Currently, there is no known cure for sickle cell anemia. However, there are several treatments available that can help manage the symptoms and complications of the condition. One of the most effective treatments for sickle cell anemia is a bone marrow transplant, also known as a stem cell transplant. This procedure involves replacing the patient's bone marrow with healthy bone marrow from a donor. While a bone marrow transplant can potentially cure sickle cell anemia, it is not without risks and complications. Finding a suitable donor can be difficult, and the procedure itself is associated with a number of potential side effects, including infection and graft versus host disease. In addition to bone marrow transplants, there are a number of other treatments available that can help manage the symptoms of sickle cell anemia and improve quality of life. These can include pain management medications, hydroxyurea, a medication that can reduce the frequency of painful crises, blood transfusions, and more. Overall, while there is no known cure for sickle cell anemia, there are a variety of treatments available that can help manage the symptoms and complications of the condition and improve quality of life for those affected. And what is the difference between sickle cell anemia and sickle cell trait? Sickle cell anemia and sickle cell trait are both genetic conditions that affect the shape of red blood cells. However, there are several key differences between the two. Sickle cell anemia is a more severe form of the condition. It is an inherited blood disorder that affects the production of hemoglobin, the protein in red blood cells that carries oxygen throughout the body. In sickle cell anemia, the abnormal hemoglobin causes red blood cells to become stiff and sickle-shaped, which can block blood flow, damage organs, and cause severe pain. Symptoms of sickle cell anemia typically appear in early childhood, and the condition can be life-threatening. Sickle cell trait, on the other hand, is a milder form of the condition. It occurs when a person inherits 1 copy of the abnormal hemoglobin gene and 1 normal hemoglobin gene from their parents. People with sickle cell trait typically do not experience symptoms, and the condition does not usually require treatment. However, People with sickle cell trait can still pass the abnormal gene on to their children, and in rare cases, they may be at increased risk for certain health complications, such as kidney disease. In summary, while both sickle cell anemia and sickle cell trait are genetic conditions that affect the shape of red blood cells, sickle cell anemia is a more severe form of the condition that can cause serious health problems, while sickle cell trait is generally a milder condition that does not typically require treatment. Sickle cell anemia can cause a number of complications that can affect various parts of the body. Some of the most common complications of sickle cell anemia include pain crises. Sickle cell anemia can cause episodes of severe pain, known as pain crises, that can last for hours or even days. These crises occur when sickle-shaped red blood cells get stuck in small blood vessels, blocking blood flow and causing damage to tissues and organs. Anemia. Sickle cell anemia can cause a type of anemia known as hemolytic anemia, where the body destroys red blood cells faster than it can produce them. This can lead to fatigue, weakness, and shortness of breath. Infections. People with sickle cell anemia are at increased risk for infections, particularly from bacteria that can cause pneumonia, meningitis, and other serious illnesses. Organ damage. Over time, sickle cell anemia can cause damage to various organs in the body, including the spleen, kidneys, liver, and bones. Stroke. Sickle cell anemia can increase the risk of stroke, particularly in children. Pulmonary hypertension. Sickle cell anemia can cause high blood pressure in the lungs, which can lead to shortness of breath, fatigue, and heart failure. Vision problems. Sickle cell anemia can damage the blood vessels in the eyes, leading to vision problems and, in rare cases, blindness. Overall, the complications of sickle cell anemia can be serious and potentially life-threatening. Regular medical care and close monitoring can help manage these complications and improve quality of life for people with sickle cell anemia. While these measures cannot completely prevent sickle cell anemia, they can help reduce the risk of having a child with the condition. Additionally, early detection and management of sickle cell anemia can help reduce the risk of complications and improve quality of life for people with the condition. We hope that this information has been helpful and informative. Don't forget to subscribe to our channel for more informative videos like this. Thanks for watching us.